Your baby takes the sunroof exit, that means it's gonna go up your butt. No baths while that incision's healing. Prolapse of some parts that you do not want coming out of you. These are general instructions. Sometimes people come for me for that, but let's be real here. C-section moms of Oregon, or wherever you are from, chew gum. Yeah. This is C-section recovery tips that you'll wish you knew sooner. Listen, I know that a cesarean section, it is likely not something that you put on your bingo card when you were sort of thinking about how you wanted to give birth to your baby. But the reality is, for some people, a cesarean section is really, really necessary for the health and safety of them or the health and safety of their baby. And most people go in hoping for a vaginal birth, but on the off chance that you do end up having a cesarean section and your baby takes the sunroof exit, let's get you some really good, valuable tips that you may need if you have to recover from a cesarean section. Tip 1 is to be kind to yourself. And this one might be the most important one on the entire list because your body just did something amazing. And so we need to treat it really well so that it has the opportunity to heal in the best way that it can. Remember, you just had major abdominal surgery. We had to go through 7 different layers to get from the outside world to the baby that you've been carrying for all of these weeks. So recovery, it may be difficult. Generally speaking, recovery from a cesarean section is going to be more intense than recovery from a vaginal birth. That said, there are some vaginal births where the recovery, it's a real doozy. It's definitely not a cakewalk, but cesarean sections, they are surgery. So the first thing you'll probably be told is not to lift anything heavier than 10 pounds. However, most babies plus a car seat is going to equal around that 10-pound mark, if not a little bit more if your baby came out with super cute chubby cheeks. So follow your provider's instructions. And basically, I always instruct my patients not to lift anything heavier than their baby and the car seat, because let's be real here, you will have places to go and you will need to lift your baby in their car seat at one point in time. But other than the heavy lifting, I also want you to remember that you need to fuel your body so it can do all of that good healing. So be sure to take in lots of water, hydrate your body, and try to eat a lot of nutrients from really healthy food sources. I mean, don't leave out the snacks. Snacks are important, but really try to give your body those nutrients that it needs to heal. And then, of course, rest, which can be really, really hard when you are a brand new parent recovering from major abdominal surgery. But if you can, lean on those around you and try to grab those little bits of rest where you can to help with that healing. While we're going through this video, I do want you to know that I personally have never had a cesarean section, but I have taken care of people as they are going through their cesarean section in the operating room side. I've also taken care of them in the recovery room, and I have discharged them home after their cesarean section. My name is Tina. I am a certified perinatal nurse and a certified breastfeeding specialist. If it is not your first time here, welcome back to the chaos. Thanks for tuning in again. And if it's your first time, I hope that you are enjoying it. Please consider subscribing and coming back for even more videos. And let's get into tip number 2. It's a really important one as well, and it is to keep up on your pain medications. All right, pain medications, these are also really important for your recovery, but I do want you to know, even though you had major abdominal surgery, you are likely going to be discharged home from the hospital with Tylenol or acetaminophen and Advil or ibuprofen. Yeah, the same medications that you buy over the counter to take if you have like a minor muscle sprain. And a lot of providers are not sending people home with medications that are stronger than that. But taking care of those pain levels is really important because we're going to discuss later in the video that movement is key to your recovery as well. And you can imagine if you are trying to move around but you're having huge levels of pain, then that movement is really going to suffer. Also, you have that little creature that you just gave birth to and you're bringing home. And I am sure in part you are going to be responsible for taking care of that little human, and that can be really, really tough if you're having big levels of pain. And the thing that I see a lot of parents do in the hospital that I would say is a mistake is waiting for that pain to increase before they ask for their pain medication. So when I'm taking care of somebody postpartum, I always advise them to take those pain medications in those first couple of days on a schedule as they've been advised by their provider. Because if you wait till the pain levels are really, really intense and then you're trying to get back on top of that pain with Tylenol and Advil, you can imagine that it can be difficult to really gain control over those levels again. Whereas if you are taking those pain medications on a safe schedule as advised, then your pain level sort of stays at a constant dull pain, as opposed to being a dull pain and then spiking up to really intense and then coming down to medium pain and then still trying to get a hold of it. So I always say, try to take them on a schedule, especially when you're in the hospital recovering. Also, you may be offered pain medications in a suppository form, which that means it's going to go up your butt. And people always ask me, I can swallow. Why are you putting something up my butt? And while I would never put something up your butt without your permission, I do always say if it is prescribed as a suppository, then that's probably the way that you should be taking it. Because I find with other patients, generally speaking, they have better results with the pain medication when it is given in a suppository form over an oral form. And that is because when medications are given rectally, generally they will work a little bit quicker, they will be a little bit more effective, and they will last a little bit longer than if you take it in your mouth and it has to go into your gut and be absorbed that way. So suppositories, though it seems a little bit weird and funky, they are a really, really good thing. And a lot of times the medication in a suppository, if it's an anti-inflammatory, which is what I give at my site, it is going to be a little bit stronger of an anti-inflammatory than like your Advil tablets. So really stay on top of those pain meds. Your third C-section recovery tip is to incorporate those small amounts of movement when it is safe to do so and when you feel up to it. And rest is really important, but incorporating that early movement following major abdominal surgery, we have a ton of evidence that tells us it's really beneficial for your recovery process. That movement is going to improve blood flow, which decreases inflammation and also helps with improved wound healing. It also is going to decrease your chances of developing blood clots, and it improves your lung functions by allowing you to clear up those secretions and get those big deep breaths in that much sooner. It also helps with your digestive system, sort of gets things kick-started, which helps with movement, which is going to help you with constipation post-operatively. So a lot of benefits to early movement after surgery. Next up, talk to your provider about compression after your cesarean section. Now we know that compression after major surgery, including a cesarean section, can be really beneficial for your healing. So when I'm talking to patients about compression, I always say, first off, follow your provider's recommendation. And then you're going to find a ton of different garments available that you could purchase for compression after surgery or compression after having a vaginal birth as well. And I always say, if you're new to it, lean more towards something that gives you a uniform compression over something that you wrap yourself. And that is because when you wrap compression around yourself, sometimes you run the risk that you might put too much compression on one end and not enough on the other, and it's not equal on both sides. And that could lend to a prolapse of some parts that you do not want coming out of you, or poor wound healing. So if it were me, I would lean towards something that was purchased that you put on in one piece. Now, when you're putting on compression, it goes over your incision. That's the whole point. You also want to make sure that it's not too tight that you can't breathe. It's not too loose that it's falling off, and you don't want to be doing compression 24/7. Make sure to give yourself compression breaks. And people that are using compression after major abdominal surgery, including cesarean sections, are actually reporting feeling more comfortable and more able to move around sooner than when they were not using compression. So that is a big, big, big one. Also, it can work to splint or support your incision, which is your next tip on the list. Anytime you are doing anything where you are adding extra strain or pressure along the incision line, so, coughing, sneezing, big laughs, which are amazing, pooping, which eventually you will do, anything that puts that strain on your fresh incision, you want to splint your incision or support your incision. So best case, you feel something coming on, you're going to grab a pillow or you're going to grab a folded up blanket. Worst case, you're going to grab whatever's around you, your partner's sweater or the fluffy dog sitting next to you or a stuffy, whatever it may be. And you take that soft object and you put it up against your incision and you basically hug it into your incision as you bear down. And that is going to help to support your incision against that pressure that's happening up against the backside of it inside of you. So splinting your incision is a really, really great idea for your healing. It's going to help to reduce any chances that your incision might come open post-operatively. Tip number 6 has to do with the care of your incision. After your surgery, you're going to have a dressing over top of your incision. And while that dressing is in place, you're not going to be doing any cleaning at all. But once that dressing comes off, now you are generally going to keep it clean and dry. And the way that you're going to do that is you're going to get into the shower and you're going to take your shower however you normally would. No baths while that incision's healing. But you're going to have your lovely postpartum shower. And whatever is happening up here with your shampoo business, you're just going to let that sort of drip over top of your incision. You don't need to be scrubbing your incision. You don't need to be cleaning it with any harsh soaps or specialized cleaners. You're just letting the shower and the remnants run over your incision. Then I always advise people to, at the end of the shower, just take the shower head or turn towards the shower and let clean water run over top of your incision. And then you know that it's clean with just water. And then you get out of the shower and you'll generally be advised to just pat it to dry. Again, you don't want to be doing any vigorous rubbing because you don't want to pull anything out that shouldn't be coming out yet. Just pat to dry. And then usually it is left open to air. And you don't usually need any special salves or lotions or anything funky happening there. I will say, Each surgeon has their preferred methods of care of your incision after your surgery, and so if you have been given specific instructions by your specific provider, then that is the instructions that you should be following for the care of your incision after your major abdominal surgery, because your provider knows you the best. So that's what you should follow. These are general instructions. Sometimes people come for me for that, but generally speaking, you keep it clean and you keep it dry. Now, if your incision was closed with sutures or stitches, these will be dissolvable. You don't need to do anything with these at all. If you had staples in your incision, these will need to be removed, which usually happens around 7 to 10 days, and you'll be instructed of that when you're discharged home from the hospital. Your only other job when it comes to incision care is to monitor for signs of infection. So if you're seeing anything like a lot of redness around the incision, or the incision is actually coming apart in places, or you have any sort of discharge that might be green or yellow, or it might smell a little bit funky, or if it's really painful for you to touch sort of the skin around the incision, or you're feeling really yucky, you have chills, you might have a fever. These are signs that your incision of your C-section might be infected, and it is incredibly important for you to report that to your provider or get checked out as soon as you can. And tip number 7, lucky number 7, this one is really, really important. Take care of your mental health. We know that childbirth itself, it is a monumental event, but when you throw in an unexpected major surgery, and a surgery that might actually veer off what you had hoped for your childbirth, that comes with a lot of new feelings that may be unexpected. So I think it's really important for you to pay attention to those feelings and those thoughts, and really talk about those feelings and thoughts with the people that are close to you. So really verbalize what you're going through with maybe your partner or your family or your friends that you are really, really close to. Also, reach out to your community. There's a lot of support groups or groups of people who have had cesarean sections, like the C-section moms of Oregon, or, wherever you're from. Those people too might also have gone through similar feelings and thoughts, and it might be really, really nice to bounce those ideas off of those people when you really feel that camaraderie because you have been through the same types of things. So mental health obviously matters with anybody and anybody who has had a baby, but when you have a C-section, you might have some feelings that come up that maybe wouldn't have been present if you had a vaginal birth. So really, really be in tune with that brain of yours because it deserves care too. All right, I know I said I was done, but I do have one more little mini tip for you, and that is after your surgery, chew gum. Yeah. I know it sounds stupidly simple, but studies are showing us that if you chew gum for 30 to 60 minutes 3 times a day after a cesarean section, it can actually help your bowels to get back to normal quicker. And it can reduce the amount of time that it takes you to toot, can reduce the amount of time it takes you to poop, and it can actually reduce the amount of time that you spend in hospital. So if you can throw a pack of your favorite gum in your bag, you could be leaps ahead. Now do me a favor, if you are a seasoned C-section mom, go ahead and throw your best recovery tips in the comments, and then our newer C-section parents can sort of pick out some things that they love, and we can all recover back to the queens that we are that much quicker. I have this video here on how you can try to avoid a C-section if you are still planning, you haven't had your baby yet, or this beauty here about the 9 things you probably don't know about C-sections. Watch that one and then tell me how many of the 9 that you knew. If you like this one, go ahead and give it a thumbs up, consider subscribing, and as always, be healthy, stay curious, have fun. Bye.